is Joe Hylton. I'm a respiratory therapist and a paramedic. My full-time job, I work for Hamilton Medical as a clinical application specialist, and I'm also the product manager for the T1, C1, MR1 for the United States. Prior to doing that job, I worked for over 25 years inside the hospitals, most recently for the last 12 years, Med Center Air Critical Care Transport in Charlotte, North Carolina, full-time for 8 years, about 4.5. And prior to that, worked inside the hospital for 7 years as a respiratory therapist, lead therapist, and a supervisor. I really didn't know what I wanted to do when I graduated high school, so that held my interest and kept me out of trouble and put me around some good people and allowed me to find a career path. From a transport perspective inside the hospital, it was really about timing. I had worked at a trauma center for about 5 years and was ready to move. I actually interviewed for the transport team in Charlotte in 2001 and didn't get selected. And I was okay with that. Timing there wasn't ready. Experience wasn't where it needed to be. So I went to work inside the hospital there. My plan was to work there 12 or 18 months inside the hospital and re-interview again. And honestly, once I got inside the hospital, I pretty much owe my career to that 7 years I spent there, because I was exposed to some very exceptional RTs, physicians, and RNs as mentors that really allowed me to grow and really make my career what it is today. I couldn't have done transport without those 7 years there. I could have left earlier, but timing wasn't there. So fall of 2008, timing and opportunity allowed me to go to transport. And in that 7 years, I'd actually built a very good relationship with the transport team. I knew many of them. We worked a lot together in ICU and the ER, things like that. So knowing them helped a lot too. So that made the transition very easy. And again, I've been doing transport 8 years full-time, and then the last 4.5 years in a part-time capacity. As far as extra training, one thing that I really try to tell folks from an RT standpoint when they're trying to look at transport, don't compare the job you're doing inside the hospital to the job you think you're going to be doing in an ambulance or on an airplane or a jet or a helicopter. Because honestly, what you're used to in the hospital, that's probably about 20% of what you're going to be doing outside. There's going to be a lot of things that traditionally would be under the nursing guys inside the hospital. That's going to be something you'll need to be responsible for and be able to do. So there's just some added things. For example, drug-assisted intubation, that may be something that someone assists with inside the hospital. And now that you're in the transport side, you're going to be a person that's potentially running the show, making the decision, doing the assessment. You may be putting the airway in. You may be drawing up drugs or selecting drugs and doing that. And it's you that's making the decision, not someone else, and you're just helping. So that's a good example. Another big example is going to be the drugs that are out there. There's about 100 drugs that we're responsible for on the transport side. And it's knowing when to use them, when not to use them, how to administer them. You may initiate and titrate a vasoactive drip. So that's something that's very new to a respiratory therapist in a lot of ways. Other things, ongoing training, skills validations. We have to do skills validations quarterly, so it's very involved. Recertifications, it's ongoing. So there's extra training almost always going on. I think this one may be surprising. I don't really have a fulfilling moment that actually stands out one over the other. If you do transport long enough, you'll experience many positive patient encounters. You're going to come across patients that you work really furiously with, that you just know are not going to have a good outcome or not make it, and they do. And you may get the chance to see them down the road, and that can be very uplifting and very emotional when those happen. And you know that the work that you did and that your partner did made a difference in potentially having a life or death situation go the right way. You'll have some to go the other way too. You'll work really hard and think things are going well, and you'll find out that there wasn't a good outcome. That's really not a fulfilling piece, but it comes with the territory. Luckily, those aren't as often as the other ways. Honestly, as I get older, as much as I love seeing patients do well. I equally get a lot of fulfillment from seeing peers or friends or someone that's on orientation that you help with, or individual that's someone that may reach out to you from across the US for a question or help, to watch them grow and perform at a very high level and be very successful at what they do. And honestly, I think that's probably a truer test of over time of what you've done. If you can pay things forward, use those experiences to help other people, that can truly multiply the effectiveness that one has. You're doing it at your primary job, and if you're able to reach out, you're helping things in other areas too, indirectly. So those types of things are equally as fulfilling, to see someone do well and know you played a hand in that. Now's probably the best time to be looking into it of any, obviously with the COVID situation that's out there. The job is in the forefront of a lot of people's eyes now, where it maybe hasn't been in the past as much. So if it's something you're interested in, please, by all means, go to a hospital, reach out, find a respiratory therapist and talk to them and try to get more info on it. If transport's something that they're interested in, obviously, please go find someone that does the job and try to get some insight from them. It's going to be a little bit harder to get into because of the specialty of it. It's very, very difficult. I don't know of anyone that's came off of the street and immediately went into a transport setting and really, really been successful with it, because there's so much of a learning curve, so much preparation that needs to happen. And again, I had 5 years under my belt when I first interviewed and didn't get in, and I was okay with that. But I knew what needed to be done to fix it, and for me, I had happiness at the place I went to try to get that, and it took me a little bit longer to get there than normal, but I'm not sorry about that at all. If anything, the 7 years I spent in the hospital instead of the 12 to 18 months that I thought I was going to do, made my interview process when I went to transport so easy and so invaluable that it was almost I don't want to say it was a shoe-in, but being a known entity and having all that behind you really made it easy to get in to interview for that job and have it offered to you. And I still had some hard spots. You're changing what you're doing and the way you think about things, and even with an experienced person coming into a transport setting, you're probably looking at about a year before you start to get comfortable. Orientation is 12 weeks. You come off of that. That's got you to a certain level to perform, but you're in no ways at the point of someone that's been there 1 or 2 years that's got some time and experience under their belt and has a better feel of things. But it just takes time. You have to temper where you think you should be with where everyone else thinks you need to be, and you can be very successful with it.